Hi, this is Dr. Gallagher. I am the founder and director of the Indiana University Gender Affirmation Surgery program. So today's question that I'm answering is, what exactly is masculoplasty? Okay, so masculoplasty is a technique recreated especially for transgender men. So, going back to basics, most surgeons who do breast surgery, general surgeons, plastic surgeons, are traditionally familiar with doing a mastectomy for a cancer reason. Top surgery, of course, is a very different type of surgery. In a cancer surgery, we're concerned with clearing out all of the breast cancer and all of the breast tissue to be safe. In masculoplasty, however, we're concerned with making a natural masculine appearance to the chest. So my goal and what most of my transgender men request is that when they're in the locker room, nobody's going to look twice, and that if they want to do so, they can pass. And really, that is the advantage of masculoplasty. There are a few other advantages to it, in that the recovery tends to be a lot nicer than traditional top surgery. So how we do this is with special dressings. We're able to allow our patients to shower on post-op day 2. Having to wait, particularly during the summer months, a week or more in order to shower is pretty problematic for most patients. The second thing is, which I think is absolutely huge, is we don't put in drains. Now, what's the big deal with drains, and why do I think it's important to avoid that? So I really made avoiding drains the focus of my career. And this would be because I always noticed when I would round on a patient after doing a big surgery on them the day before, and even if they had a big incision, I'd say, where does it hurt? And they would always point to the drains. So drains are painful, they're annoying, they fall out too early, they have to be put through a separate scar. And to be honest, the thing they're supposed to do is to prevent fluid collections, and they don't always do it too well. So the alternative technique we use in masculoplasty closes down that space that the drain would usually be sitting in. So we just take a few minutes, it really doesn't take long, to close down that space after we remove the breast tissue, and in that way we're able to avoid drains. And it's more than just a comfort issue for the recovery, because what we've shown is in our patients 300 masculoplasties we did consecutively or in a row, we saw absolutely no fluid collections in those patients. And more importantly, we saw just one hematoma. Now, in previous studies, up to 11% of patients done through the traditional top surgery technique had hematomas. So that would be 0.3% of our patients. That's pretty exciting. And another reason masculoplasty is gaining popularity. So I hope this answers the question. Head over to our Instagram at Dr. S. Gallagher, Twitter, Facebook. We've got a ton of before and after pictures on there. Lots of patients who've had this masculoplasty procedure.